All right, we really have an extraordinary afternoon session with a lot of new content for you all. So I'm going to invite up Catherine Codispoti, who is not a pediatrician. Catherine is our Executive Vice President and Chief People Officer at Children's, who deals with HR and hiring and workforce retention. And Catherine will chat a little bit about what we're all struggling with in our practices, as well as introduce our next presentation.
Great, thank you. Good afternoon, it's a pleasure to be here. And so in the spirit of inclusivity, I'm going to give a brief visual description. So I am a white female. I have brown hair that is actively graying, especially over the last 3 years. I'm wearing a black dress, and I use she, her pronouns. As Dr. Weissman said, I'm the Chief People Officer, but that is my second job. My first job, so my number one job is wife and mom of 3, and I'm also a proud dog mom. But I also, Children's is very special to me. So I not only a mom, not only an executive at Children's, but all 3 of my children go to CNPA. And actually my middle daughter, who's now 6, had a fairly rare infection and saw actually Dr. DiBiase's team and received the most incredible care. So I am a very, very grateful parent as well. And so not like I need to, reiterate this in detail, but, when we think back over the last 3 years and not only the pandemic and, when you think back at those initial few months, right, just the immense pressures and stress, both professionally and personally for healthcare providers was tremendous. And then, as Dr. DiBiase had mentioned, right, we have the subsequent waves of COVID. We're now seeing these, the tridemic, right, with RSV and flu. We're seeing all these threats against healthcare workers because the mental health of our people, our population, our citizens is not where it needs to be. And then underpinning all of that, you had George Floyd, Breonna Taylor, many, many others, right? All of that within the social injustice. And so it's just created a tremendous stress on our community. And so I'm sure all of you have heard, right, the Great Resignation. I think everybody talks about it. I'm actually tired about talking about it. I want to move on from that. And so you'll see the new term that I like better. But when we step back and think about the Great Resignation, right, all these things that we've got in the bubbles really contributed to people taking a step back. I mean, and again, in the first months, we saw more women leave the workforce than we had ever seen, ever. And a lot of it had to do with reprioritizing the things in their life, caring for their children, caring for their parents. And along with that, people have started really reassessing, reprioritizing what's important to them as an individual, as a family. And so that's why I like the new term, the Great Reassessment, because I think that's exactly what our employees are doing. They're reassessing and reprioritizing their lives and what's important to them personally, professionally, and their families. And so with all that as kind of the backdrop, what I would say to you is when we think about workforce retention strategies specifically, the first thing you need to think about is your culture. What is your culture? It is your brand. When we start thinking about social media and Yelp reviews and Glassdoor, not only is it important to retaining your people, it's important to recruiting them, but it's also very public. Everybody knows what's going on. And so when we talk about culture, I think what's really important is to think about it in the context of your employee experience, because that is the expression. That's how your people feel and receive your culture, is through their experience with it. And so I think the first thing we all have to do in this great reassessment is know our culture, know our employee experience. And you could do that through a variety of mechanisms, such as what I had referenced through social media, right? Get a sense of what people are saying externally. But you can even do internal surveys or pulses. Stay and exit interviews are both really effective. They can be quick. You want to understand why people stay with you. Why did they stay during the pandemic? What keeps them here? And those that are leaving, that's also really important data too. But that could be a 10-minute conversation. And so even as very, very busy practitioners, you can get really valuable insights that can help you drive change or come up with solutions that could help with retaining those individuals that are critical to your practice. The other thing I would say that is also very different is that we have moved more to a space where we have to understand the individual's unique needs, because everybody has very unique needs, priorities, again, and going back to the reassessment. So, in HR, a lot of times we talk about, consistency, standardization, that is key. Well, that's not really working for us right now. So we have to start thinking differently. And that's why, again, having that personal connection and understanding what motivates, what drives your team, and from a very individual perspective is very beneficial. So this is a diagram or chart from Josh Burson. He's considered kind of an HR guru, for lack of a better way to put it. And he's been in this field for over 20 years. He's kind of evolved what he's called this irresistible organization over the years. This is the most recent release based on the pandemic and the experience of it. And I think it really hits on what we need to think about. I'm not saying that compensation is not a fundamental, but it's not the only thing. There's a lot of things that we can do outside of pay that can make a huge impact in retaining your people. The beauty of working in healthcare is, I would argue, that meaningful work is there. That's a given. Hands-on management, right? That's really empowering your people, giving them the tools that they need to do their best work. Positive environment, flexibility. That's a really big one right now. Flexibility, rewards, recognition, and I would argue most importantly, belonging. So in many instances, we talk about diversity, equity, and inclusion, and those are all extremely important. Belonging, I would argue, is kind of that next piece. It's because there's a connection. You have a real connection with your workplace. We spend more time at work with our colleagues in most instances than we do with our own families. And so you need that connection. Health and well-being, of course, right? We talk about that all the time, especially as providers. Self-care, whether that's mental, physical, financial health, physical safety. And how can we also do that to not only help the individual, but potentially their families? Growth, that's something we're hearing a lot about as well. Growth opportunities, whether that's upward or just exposure to new things, growing skill sets, being put on new projects, flexing different muscles, so to speak. Trust and leadership, that's huge. Transparency, trust, empathy. So I'm going to focus on a few because I have some, what I would argue are things that you could do, again, without having to throw a bunch of money at it, that can make a significant difference. And so I'm going to focus on three. Positive environment. One thing we hear consistently, and I'm sure this would be of no surprise to you, is that there's just a lot of administrative burden on our teams. It's exhausting. And so where can we take out those administrative tasks that are not value add? And what I would suggest is that you ensure that as you're thinking through those things, right, those are things that your employees can bring to you. They know what those are. Create a supportive environment. So that's psychological safety, right? Creating a safe space for them to bring their concerns forward so that you can actively work through it as a team. Rewards and recognition, whether that be individual or team oriented. One thing that I think is really important here too, is that when we think back to the understanding the unique needs too, what I would tell you is that you also need to be effective in kind of the rewards and recognition space. You need to know the individual motivators and the way in which people like to receive feedback as well. or recognition. Some people would love to be, called out in a forum like this in front of their peers. Others, that would be awful. It would be devaluing and a demotivator. And so understanding that is really important as well. Encouraging self-care, encouraging them to use their vacation, encouraging them to use their benefits. And then flexibility. Job sharing was a thing once, it kind of went away. I would argue that's going to be very much something that we're going to be using a lot more. And it's because it allows people the flexibility. So if I want to, if I need to go drop my sibling, my child off rather, and then get to work, I can do that depending on how I'm able to structure my schedule. It's, in addition to that, telework, right? Instances where I don't need to be in the office, but I could do some of those maybe administrative documentation, calls, things like that. I can do that in my home. Those are the things that, from a non-financial perspective, I think will really contribute to this positive environment. And then lastly, promoting diversity, equity, inclusion, and belonging. That's extremely important. Health and well-being. What I would say here is you have to lead by example. That's the biggest thing. We just had we just finished our employee engagement survey. We used to do it every 6 months. During the pandemic, it was every year. And so we just closed it out. And one of the common themes that we saw is, when I take my vacation, will you just give me my space? Like, just let me take my vacation. Don't call me. Well, I have a vacation day and I'm supposed to be out of the office. And I'm not saying that y'all do that, but it could be simple things like that. Boundary setting, right? And leading by example. If you're going to be out of the office as the leader, be out of the office. Empower your teams. It means the world. Growth and opportunity. That's another thing, and it's hard. Millennials, I'm one of them. And Gen Z, right? We're known for changing jobs every 2-3 years. That's not going to change. It's not going to change. But what I would say is, we can get more creative as long as they're growing and they feel like they're learning and they're doing different things, they'll stay with you. And so just being thoughtful about how can you do that? How can you give different opportunities, whether it's to work on a project to reduce the administrative burden and lean out some of your processes, things like that. Lunch and learns too. Empower your folks. If there's something that they're really excited about and they think that they could bring forward and teach others, have them do that. Again, it's allowing them to learn presentation skills, organization skills, things like that. So it can be really simple things. Again, I'm going to reiterate, no one solution will work. And, all of you have your own kind of cultures. Depending on the size of your practice, you're going to have your own subcultures, right? And those are all things that you have to take into account. But what I would emphasize is that you have to encourage your employees. You have to include your employees in the solutioning. They have to be a part of it. They know the best. In many instances, if you engage them, they will be your biggest champions. And then the other thing, I love effort impact matrices. I think they're great. And you can go through an exercise like that, in an afternoon and determine what short-term things would be high impact, low effort that you could do immediately to get some gains so that you can retain that top talent. And then there's going to be, of course, always instances where you've got that high impact, but it's going to take a lot of work. And so, think through how can you move through that body of work over a period of time. Here's some potential strategies. I've referenced a lot of these too. Remote or hybrid roles where available, flexible schedules. I'm going to reiterate, I think that's really key. I think that's really, really key. Meetings and email etiquette. That's something we also heard a lot from our teams. Don't be emailing me at 9:00 at night because I'm going to feel like I have to respond. Don't do that. diversify your sourcing methodologies. The other thing I would say, being an HR, everybody's a recruiter. Everybody's a recruiter. So recruit your own. Change up your recruitment methodology, right? I think that's an opportunity. And then get creative with your what we call total rewards, which is compensation and benefits. Longer term, I think we're really going to have to think about how are we redesigning our work, redesigning the roles. Because the other thing too is we know coming into the pandemic that there was a nursing shortage, there was a respiratory therapy shortage, right? And so all of these things are only worse, frankly. And so we've got to start thinking about how we can do some of this differently. But that is a longer term strategy, but I think something that will be very impactful to healthcare generally. So as far as actionable next steps, things that you could, leave this meeting and do, again, engage your employees in solutioning, identify those short and long-term tactics. I would tell you to, choose 3, have some of your employees own them, champion them, and then determine those 2 longer-term solutions that you really want to work with as a group and move through that. And so that's the conclusion of my talk. I would love any questions or comments.
Hi,
Hi.
manager. So I'm listening carefully to you. Can you talk a little bit more about this concept of flexible scheduling in environments that may not perceive that that's an option at all?
It's an excellent question. Excellent question. So what I would say is, try to get support to pilot it. So take a group of folks where you work through what a flexible schedule could look like. And then create some sort of metrics, right? You want to make sure that there's no impact to, the clinic's scheduling, no impact on returning of calls, right? You can create kind of those metrics, I think, to monitor throughout your pilot to really show that you could do this effectively. It's just thinking creatively and doing something different. If you figure it out, let me know. Other questions, thoughts?
One thing we did I'm Suzanne Powers, resident town center pediatrics pediatrician. One thing we did with one of our nurses was having some family problems and had to be home to take care basically of her aunt. And we were having a very difficult time trying to get all of our phones answered right at 8 a.m. when everyone calls. So we actually have her doing triage from home so that she can take care of her aunt and do whatever she needs to get done at home. But she's also answering the phones, which is taking a lot of burden off of our in-house triage people. So that's one thing that we just instituted here.
That's fabulous. And that's exactly what I was referencing as far as like, we can do some of these things differently and still meet the, organization, the practice needs, but then meet the unique needs of that individual. That's a great example. Thank you for sharing. I think I saw someone else had a question or comment. No? Okay. Well, thank you.